Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for tuning in. Our guest is Dr. Jason Wasfy, Assistant Medical Director at Massachusetts General Physicians Organization, Director of Quality and Analytics at Mass General Hospital Heart Center, and he's joining us today to talk about his work and the research and topics that he presented at the American Heart Association's scientific sessions. Welcome to Health Professional Radio, Dr. Jason Wasfy.
Thank you so much. I'm delighted to be here, and I appreciate your interest in my work.
A brief background about yourself. Talk about how you got into your field and what your role is there at Mass General.
Thank you. Yeah, I am really passionate about improving the quality of care we deliver to patients with heart disease. And for a number of years, it wasn't totally clear how I could best do that. But I had a lot of mentors who were highly clinical and really committed to the patients they serve. But increasingly, I saw that my best role might be in trying to understand with a high degree of rigor what interventions we could help our patients with the most. So a lot of what we do is we try to improve healthcare delivery to cardiology patients at Mass General. But importantly, we study those interventions in detailed ways to make sure that we understand in great detail what these interventions are doing for our patients, if they're useful. Because if they're useful, we want to expand them. We want to share them with other institutions so that larger populations can benefit from this type of knowledge.
Now, you recently gave a presentation based on your research. What research and topics did you present?
The presentation was actually mostly a summary of other people's work. We're very interested in disparities between different types of patients. So it's well known that certain types of clinical outcomes, Black patients, for example, have much poorer outcomes in certain areas than white patients. Women patients compared to male patients, patients of different socioeconomic status. So this is a critically important area of investigation for a number of reasons. First of all, we want a healthcare system that is equitable and helps everyone. Mm-hmm. And so understanding how to do that, I think we first have to understand why the outcomes are different in different populations. But there's another point that I think is really important to make, which is that studying disparities between different types of patients and clinical outcomes may give us information that helps us help all patients. Because if there's ways in which we're not delivering care that's affecting certain populations, it may still be affecting populations other than minority populations or underserved populations in other ways, so that it gives us basic understanding of how to deliver care in a more efficient way that's helpful to the needs of our patients.
What was one of the most eye-opening findings of some of the research that you were presenting?
I think, and again, this isn't our primary work, but it's stuff that I've summarized and synthesized for the presentation. I think there's very striking differences between Black patients and white patients in terms of hospital readmission rates. A lot of that has to do with the different hospitals that patients tend to go to, but there are differences even within the same hospitals between racial and ethnic groups. So I think that if they're very striking findings, the magnitudes are pretty significant, and we really have to do more to understand this. Again, I think that understanding this better will help the populations that are having these worse outcomes, but it also may give us a fundamental understanding about how to improve the quality of care for all patients.
Where that quality of care is concerned, did you discover a ratio between what was a physical aspect of the disparity and an environmental aspect of the disparity, even within the hospital?
Yeah, so some other groups have done very sophisticated statistical analyses that disentangle effects of hospitals from effects of patients. A lot of this is done by Dr. Karen Joint-Maddox and Dr. Ashish Jha, looking at, there's certain hospitals that more Black patients tend to go to because of where they are, and there are other hospitals that more white patients tend to go to. But through techniques in statistical analysis, and regression techniques, you can disentangle the effects of the hospitals from the effects of the individual patients. So it does appear that both matter. It appears that the hospitals that more often serve Black patients have higher readmission rates, for example. But even when you look at the same hospitals white patients at these hospitals have lower readmission rates than black patients. So that suggests that there's two things going on. There's something related to race directly, but there's also something related to the hospitals that different racial and ethnic groups tend to go to.
Was the research confined to cardiovascular patients only?
The stuff that I'm presenting, it's all about acute myocardial infarction, heart attacks, and congestive heart failure.
Mm-hmm. Did you find similar, not maybe as severe readmission rates, but at least some type of readmission rate based on the ratio of white to black in, say, more white patronized hospitals?
Yeah, it's an interesting statistical problem because there are more white patients in America than black patients. The hospitals that serve more white patients have very, very low numbers of black patients. So the most interesting analyses are the patients at the hospitals that serve more black patients because they tend to be more mixed. Otherwise, you run into problems with statistical sort of low numbers and hard to distinguish between groups. But what is pretty clear is that black patients are readmitted more often than white patients, and that at hospitals that serve high numbers of black patients, even the white patients at those hospitals get readmitted more often than the white patients at the hospitals that serve white patients. So a lot of this is heavy statistical stuff, but it really does matter. It does suggest there's two reasons why black patients are being readmitted to the hospital more often. One is related to potential quality of care issues at hospitals that serve black patients. So that helps us because we can implement quality improvement strategies directed at those hospitals. But there also seems to be issues around specific patients. So then we really have to struggle a lot with thinking through, do we have unconscious biases as clinicians? Are we delivering care in a way that's better for some patients and less good for other patients? Are there differences between patients in terms of how they respond to our therapies? Those are the sorts of questions I think that need to be struggled through so that we can improve health equity, but also improve the quality of care for all patients.
So what trends in research do you see toward that end?
Our group in particular, we're very interested in building upon some of this work that has been done by others in understanding the effects of health reform. So we're very interested in that there have been a number of analyses that have focused on passage of the Affordable Care Act of 2010. So a lot of the elements of the Affordable Care Act were focused on improving the quality of care. What we want to also do is assess how that, did all these programs improve the quality of care? We believe that some of them did, but there's still some unanswered questions. But also, in improving the quality of care, did we improve the quality of care for all populations equally? Did populations known to do have worse clinical outcomes, in some cases black patients, in cases women patients, patients from poorer communities, did the improvement affect them as much as it affected other patients? I think those are critically important questions because it will assess how health reform, A, improved the quality of care, but B, even if it did improve the quality of care, we want to make sure it's done so in an equitable way.
Now, where can we go and get some more information about some of the information that you presented recently?
I'm certainly happy to share the slides with anyone. I think a lot of it references previous work by people like Karen Joint, Maddox, and Ashish Jha that have been previously published in the academic literature.
Well, I thank you for joining us today. Some fascinating information. I'm hoping you'll come back and give us some more in the future.
It's my pleasure. I really appreciate your interest in these important topics.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. Subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.